Hi, my name is Michelle Delahunty, and in this video I'm going to give you the quickest rundown of the articulation tip sheets that I can, because I know how busy you are today and every day. Parents and caregivers are busy too, and that's the biggest reason why I made these tip sheets. Parents need a lot more education and guidance before they can effectively practice speech sounds with their kids in between SLP sessions. And they're busy, so they need to know how to do speech sound practice during everyday activities with their kids. Most parents can't do worksheets or other activities that we often do assign to them that require them to carve out extra time in their schedules that just doesn't exist. Or even worse, print something off or find an email in their inbox or keep track of papers. And we as SLPs often don't have the time to provide the type of education and support that parents really do need. And many of us don't have much access to parents of the children that we work with anyway. Yet we know that our treatment programs will not be as effective or as efficient as they can be without consistent and accurate home practice of speech targets in between sessions. If you want to look more closely at strategies for deeply engaging with parents and caregivers, communicating more efficiently with them, and teaching them how to really incorporate speech sound practice into their daily activities, please refer to some of my other resources, including a lot of free resources for SLPs that are interested in upping their parent engagement in all types of speech therapy programs. But this video is about the tip sheet, so let's focus on that for now. Each tip sheet is one double-sided page, and you give it to parents and caregivers once a target is at the point in your treatment when you feel home practice can be done accurately. The purpose of the tip sheet is to efficiently meet the following goals. Number one, provide parents with the basics, the things that we always tell parents, like how a target is produced, how that sound is represented in words and common spelling, the cues that are helpful, the steps in the speech complexity hierarchy that we'll be moving through, etc. And this framework is important. We often tend to give parents this information on the fly, maybe verbally during a session, without writing it down, or in the presence of distraction, like a child pulling them out of the room because the session's already done and we're just wasting their time. And we know that people don't learn that way. So this tip allows parents to post the information where they can reference it over and over again and make sure that we cover this basic information consistently, no matter what's happening in that first session, no matter who's there, so that other team members can have access to it too. And these tip sheets do go hand in hand with a method that I teach parents for speech home practice that they can easily incorporate into their daily life. It greatly increases the chances not only of speech practice getting done, but actually getting done well and getting done frequently enough to make an impact on the rate of progress through speech treatment. I will provide a few more details about that method in just a moment as we do a quick tour of the sheet format. The purpose of section 1 is to introduce yourself to parents and begin to establish the parent's role in the speech therapy process. There is a place for you to provide your contact information, and that's especially useful for SLPs that don't see parents very much. Section 2 gives parents some essential information about the target that they're working on. This information is often given verbally to parents if they're in sessions with their kids, but often not written down. And like I said earlier, it's really valuable for this information to be written down and available for parents to look back on many times to encourage deeper learning and understanding of the target. So here, for S initial, there's an explanation of how that sound itself is made. It's pretty explicit. It tells parents the tip of the tongue is behind the front teeth. It can be pointing up or down. You make continuous airflow directed over the center of the tongue through the small space created between the tongue and the hard palate. So those are for the parents that do well with print information. Then it's what it sounds like. So it tells parents that they're looking for a clear hissing sound like a balloon or a tire deflating. It's a continuous sound, and it does not sound like s. And there's a little note there to look for the demos online, because on the website that parents can be directed to, they can actually hear a demonstration of that sound. We talk about what the common errors are for that sound. We talk about how a sound is spelled, and that's really important for some targets. We know that. Parents can get really confused with letters versus sounds, and so that's explained for them. We tell them some of the cues that we might be using, verbal cues, visual, object, gesture cues. And this blank space here on the side is a place for you to provide the exact cues that you are using with that child that parents can use in their home practice. And this red stop sign shape warns parents to stop if practice is not going well. This is a really important point to tell parents to help avoid negative practice that can really work against our therapy progress and deeply impact a student's motivation and willingness to attempt targets both at home and in our future sessions. Section 3 has the complexity hierarchy that I think we can all agree is so important for parents to know about. When I work with parents, I make sure that they are deeply aware of the step that we're currently working at for a specific target, as well as the process of moving up and down the staircase when accuracy is not there when they're practicing at home. Parents are informed and reminded that practice has to be accurate. The child has to be engaged in the activity, and every effort should be made to get lots and lots of accurate reps in during practice. This QR code leads parents to a video that gives them more tips and directions for using the tip sheets for practicing speech sound targets. You can check out that video on YouTube as well, just to see what parents see when they go to that link. This video is packed with helpful information, but the main message to parents is that speech sound practice can be easily incorporated into daily life. It introduces them to the method that I teach, which is the speech activity routine. Now in this video, I'm not really going to get into the speech activity routine much other than to say that it is a sentence format that you teach parents how to complete, where they take any activity or daily routine, anything that they do with their child or they want to do with their child or that their child might be interested in, and complete the following sentence format. When we blank, that's the routine. So when we climb the stairs, when we rake the leaves, when we go swimming, when we drive to soccer practice, when we set the table, when we make snack, when we eat dinner, when we have bath, whatever the routine is. When we have a bath, we're going to say, and the blank here is what I call a repeatable speech turn. So it's what the child is going to say as a form of speech therapy practice. So when we take a bath, we're going to say splash. Every time we blank, that blank is the repetitive action or step. So it's the thing in the routine that gets repeated over and over again that we attach a repeatable speech turn or the speech target to. So in the example of the bath again, when we take a bath, we're going to say splash every time we splash water on our bath toys. So that could be for a child that's working on reducing a lisp or S-blends or L or SH at the end or final consonants or fricatives or what have you. Or it might be when we take a bath, we're going to say wash every time we wash a body part with our cloth, because that child might be working on W or SH final or CVC or final fricatives. So this is not really a new concept, but my approach is to teach parents how to create these opportunities in their everyday life. And this tip sheet helps them to do that. And I'll give you more explanation about how that works when we get to page 2. But for right now, that video is just more education for parents on what a speech activity routine is and how they can use them in their daily life to get speech sound practice done. We're going to move on in this video, but there is some information there on this slide about other resources that you can use to teach parents speech activity routines or to learn more yourself. So there is a 4-day course for SLPs. There's the Parent Speech Helpers course, which is a course for parents. There's my website where you can get more information. There's a YouTube channel where there's more demonstration of speech activity routines for families. So check out those resources if you want to go more deeply into what the speech activity routine is. But let's move on now to page 2. So page 2 has a couple of different components. Number 1, it gives parents some actual examples of how they can practice at the different levels of the hierarchy. So you'll see that there's a little tip for isolation level practice and for syllable level, word level. Down here we then have phrase level, sentence level, and structure conversation. So it gives parents some really tangible ideas right off the fly of things that they can do for practicing that target in a speech activity routine sort of approach. So at isolation level, you're just teaching using, say, the Fast 5 technique, which is the one I use, where you just put up your hand and a child has to do their sound in isolation 5 times. And then they do the repetitive action or step in the routine that they're doing. Similarly, with syllable level, you just give them a vowel and they do the same thing, sa, 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 sa. And then they go ahead and take their action or step in the activity routine, whether that's a game or a daily activity or some other thing that the parents and children are doing at that time. The word level section is huge, and that is the one that I often have to explain to other SLPs because we're used to giving parents a very small set of words. And this speech activity routine approach also encourages parents to use a very small set of words. However, the range of words that are available to them is wide. So within an activity, they may be only saying soap every time they squirt a little bit of foam soap on their child's hand in the bathtub so that they can wash a body part. So the routine at word level would be have the child say soap and they get a little squirt of soap and then they wash all their toys, they wash the baby dolls, they wash themselves, and you get lots and lots of reps in that way. So it is only one word. However, having the parents have access to all the possible words that would match the target that they're working on in speech therapy can be very, very powerful because we don't have access to every single child's lifestyle, family culture, family activities that could possibly work when they want to practice at home. Moreover, most of the things that we give out as traditional speech therapy homework is really focused on nouns and things that are easily depicted as a picture, but not necessarily the most functional or frequent words that are in our vocabulary. So if the goal is to really promote generalization from the beginning, using words that are really relevant to each family's daily experiences is really key. And so providing them with all the different options can, number one, inspire them. So looking through the words, they might see a word and say, hey, I can do an activity around sourdough bread, or I can do an activity around circles as we circle all the things in the workbooks that my child likes to do. Or I see salad there, let's make salad for supper and use the word salad as part of a speech activity routine as my child is making that with me. Having this huge vocabulary option for families increases their ability to practice. They can use words that are not so easily depicted. They can see the target in more areas of their everyday life, and you can really increase the opportunities for speech sound practice that way. I actually use them in sessions sometimes as well when I'm trying to plan a session and I can't really think of a word that goes with the activity I'm about to do. I pull out the articulation tip sheet and have a quick scan through, and I can almost always find something that I can work into that activity. Now let's quickly talk about practicality of using such a sheet in your speech therapy programming. Number one, my biggest tip to you is to just prep ahead. So when you're about to work on a new speech sound target with a child, I recommend that you print this twice. So have one in the child's chart at all times and have a second one ready to give out to that family, whether you're sending it home because you see the child in school or whether you're passing it to them directly. It is far better if you can to print it then send it as a PDF. You do have it as a PDF. You can send it with some instructions to parents to print it on a double-sided format and ask them to post it. But if you make it easier for parents, if you take away some of those barriers by doing it yourself, if you're fortunate enough to have somebody who can do that for you, what I have found works really well with these sheets is to print them double-sided on cardstock if you can, because that makes it stand out a little bit more in the sea of papers that families have. Even better than that, put a plastic covering around it. So buy a box of sheet protectors, put the articulation tip sheet in the sheet protector, send it home that way. And one more step can really help to ensure that this gets prominence in that family's life is to grab a Post-it note and just write on there, post in your home, or post on the fridge, or talk to the parents about where they could put that will really help them to remember to do the speech activity routines that they've already planned or thought about. Now, I have resources that you can use for planning them together, but doing that in a session where you ask parents to supply you with some of their routines and talk together about what those repetitive steps are that you can attach repeatable speech turns to. Use the free videos on YouTube to show parents all the different types of speech activity routines and the different applications of this approach so that parents can really get good by watching examples and the repetition that we all need to learn. They can really master this approach as well. If you have seen my other resources or you know my work, you will know that articulation tip sheets are just one component, albeit a key component, of my comprehensive plan for total parent engagement in speech sound therapy. Over my 25-year career as a speech language pathologist, I know all too well the barriers that we face in trying to get speech sound practice done. And as a busy parent myself, I know the barriers that parents face in trying to get anything extra done during the day. And I know that the only way for treatment to be efficient and as effective and maximally beneficial as possible is to find a way to overcome these barriers. Our clients need to be getting lots and lots of accurate reps in each day, ideally more than 100 reps each day in between sessions. And I've found a way to accomplish this in my practice. And I have help for SLPs no matter where you work and how much or how little access you have to parents and caregivers. So please check out my other resources, all linked below. And if you have any feedback for me regarding the articulation tip sheets, if there's a certain speech sound target that you really want one made for, just get in touch anytime. Thanks so much and have a great day.